was about underrepresentation of senior women in leadership positions and how to break the glass ceiling. Well, it turns out that about 50% of the matriculating class all through the nation in the US are women, so 50% women in medical school. However, as we go up the academic ladder, women are not represented as well in leadership positions, and in addition, only 13% of the 13,000 gastroenterologists in the US are women, and about 30% of the hepatologists in the US are women. The thought is, which is a false sort of conception, is that there hasn't been enough time in the pipeline for women to get to leadership positions. However, women have been 50% of medical school classes for over 30 years. In my class at UCSF, we had 50% women. I was class of '84. And so that's a misconception, but I think it's institutional as well as individual, and institutions don't have the resources and really the transparency of getting women to the table and into leadership positions. There aren't enough women mentors and sponsors in GI and hepatology, but it really comes from the top because there aren't enough leaders in those positions, so it sort of trickles down. Yes, absolutely. I'm in surgery, and in surgery, really only about 3% of women are professors of surgery. In medicine, it's a little bit more, and in terms of chairs, 1% of chairs of surgery are women, and about 13% of chairs in medicine are women. Well, I think some of it is that there are lack of mentors to entice women to go into the field of gastroenterology. Also, it's more male-dominated in terms of being procedural. It's very technical with the diagnostic and invasive procedures that are done. I mean, it even balances down to the size of an endoscope dial are made for men's hands, not women's hands. And we have the same problem in surgery, where the tools that we use are really geared for people with larger hands. And so naturally, more men are comfortable. Again, but I think the main issue is getting the inspirational mentors at the top that are women to inspire other women to go into the field. Because really, we usually follow people that we emulate and we want to be like. And if there aren't any women doing that, then it sort of has a catch-22 effect. I think the institutions need to realize, again, that women are adequate, exceptional leaders, and that they are really the powerhouse to balance the patients we take care of, the students we mentor. And I think it's just not an awareness. There aren't the resources. There aren't the mentors and sponsors, as I mentioned before, and there really aren't the resources in terms of bringing women into networking. And I think that's why this symposium that we had this morning was really a nice start about getting women at the table. Having women listen to means to step into leadership positions. I think institutions have to recognize the family-friendly environment, so that none of these 6 o'clock in the morning meetings, 6 o'clock at night meetings, and that because childcare, and it falls on women more than men. Today it's gotten better, but I think women have the household responsibilities, the parenting responsibilities, and so many other responsibilities that it's very hard if meetings and interactions with their peers are at the early hours or late hours of the day. It's more difficult for them to be there, or Saturday morning meetings, things like that. So I think if institutions can be aware of that and change the culture. In addition, women shouldn't have to negotiate for their salaries. It's been proven across all fields, not only medicine, but law and corporate business, that women make less salary. And in fact, women make 22% gastroenterologists make 22% less than men in a study that I read. And I think the women shouldn't have to negotiate. It should be the institutions that negotiate for them and look at transparency of salaries and make it equitable. It shouldn't have to be that the women, it's on the women's shoulders to have to ask for this, because we aren't very good negotiators. But the institutions should actually look into these things and be more equitable and more transparent about things like salary and resources and promotion and all those things that I think, again, are not widespread institutionally.